Before we talk about taking your blood pressure, let's go over a few basics. Make sure you have the right blood pressure machine, as there are different brands. I'll personally recommend the Omron brand used by most health professionals in the UK. There are different types like the electronic and the manual. You want the electronic blood pressure machine if you're going to be taking your blood pressure yourself and not a doctor or nurse. You have the wrist and upper arm electronic blood pressure machine. You want the upper arm blood pressure machine, which will be more accurate as it's closer to the heart. You can use the wrist if it's easier to do yourself or you have a medical condition that prevents you from using the upper arm. Ensure you have the right blood pressure cuff size for your arm. Adult cuffs come in different sizes as small, medium, large and extra large. If it's too tight, then your blood pressure reading might be higher than it should be. And if it's loose, then your blood pressure might be lower than it should be. It should wrap around your arm so that it fits and you're not in discomfort. Blood pressure machines lose their accuracy over time, so you want to either calibrate it once every 2 years or buy a new blood pressure machine. Now that you have chosen your blood pressure machine, you now want to take your blood pressure. Make sure that you're relaxed and rested for at least 30 minutes before taking your blood pressure. Being stressed or anxious would give you high blood pressure readings. You should take it in a comfortable environment such as your home to avoid white coat syndrome, which is when your blood pressure goes up when someone else is taking it, or in another place such as the GP surgery. Your arm should be on the table and at the same level as your heart. A lot of doctors will say use the left arm as this is closest to the heart, but it really does not make any significant difference if left or right arm. Wrap the cuff over your arm at least 2 centimeters above the elbow and press the button. You will feel the pressure in your arm, but not too tight that you're in pain. If so, then you should stop as you're using the wrong size cuff. Otherwise, continue and you should see the readings go up and they start to come down as the cuff deflates. The usual range is between 90/60 and 120/80. Adults under the age of 80 should expect readings of below 135/85, while adults over the age of 80 should expect a reading of below 150/90. If the first reading is high, discard this reading, wait 5 minutes and repeat the blood pressure again. If it is still high, then check the other arm to compare readings and take the lowest of the two. If you have high blood pressure readings, then you should take your readings for 7 days. Do this twice, morning and evening, then calculate the average of the top and the bottom. If above 135/85, then speak to your doctor or nurse, as this could indicate an underlying medical problem as well as having possible high blood pressure. The top reading is the systolic blood pressure reading when the blood is pumped around the body from the heart, while the lower reading is the diastolic blood pressure reading when blood is filling into the heart. Possible causes of a high blood pressure can include stroke, heart attack, high cholesterol, high salt intake, fatty foods, thyroid problems, kidney problems, smoking, excess alcohol, lack of exercise, obesity, and stress. So if you have any of these medical problems and you've noticed high blood pressure, then please see your doctor or nurse.